Hey there and welcome to Simply Radiology. In this video, I want to teach you the most important stuff you have to know about the elbow joint. So let's get started. Alright, so just a quick introduction. My name is Ivan and I'm working as a radiologist. I think my job is seriously really awesome and I love it. So I want to share the stuff I learn at work with you guys. And to be honest, I wish I had this stuff before I began my specialty because this would have saved me so much time. So what I want to show you today is how to diagnose almost all fractures that you will find in the elbow joint. I want to give you key hints and really important tips and what to look for in every image. More, I will tell you some important stuff that can be valuable if you're a radiologist. I'm going to later be reporting to clinicians. I will tell you stuff about the famous sale sign. I will come to that later. And finally, my goal is to make you at least somehow confident in looking at these images and finding the pathology by yourself. So, before we move on, just a quick recap of what we have to know. When it comes to imaging of the bones, and especially with fractures, we have to follow the cortical bone very carefully, all the way. And that's basically the outer alignment of the bone. So please follow that line for the whole bone anatomy. Then we're going to also look at all the angles. Please, it's really important. Furthermore, I will tell you more about the fat pad sign or the sale sign. And please forget about classifications and eponyms for now. You're not going to need that. You can memorize that, you can Google that stuff if you really have to know. But what you have to know in the beginning is how to find pathology, how to find these fractures. That's the most important part. Okay guys, so we have our first patient. It's a normal picture, normal image of the elbow joint. And this is how it looks like. As I said, you have to be confident and you have to be familiar with normal anatomy before you move on to something more advanced like pathologies and fractures and stuff like that. So please try to get a hang of how it looks like. I will tell you some quick anatomy locations of the elbow joint. Quick anatomy then is we have the radius here. This is the head of the radius. We have the ulna bone here. Behind the ulna you can see the olecranon. It's also visible. This part is the olecranon. Here you have the humerus. And these are the condyles. So for example the radial condyle because it's on the radial side. So radial condyle, and here is the humeral condyle. You can also call it the medial condyle because it's on the medial side, and the lateral condyle. So this stuff is basic anatomy, but just a quick recap. So like I said, when it comes to normal anatomy, what did I tell you? Please follow the cortex. This is the cortex. You have to follow it all the way. Try to find the cortex going all the way. There should not be a fracture here or some disruption or something else that could indicate pathology. It has to look smooth, and you use this on all your angles. Even here you try to look very carefully because I will show you later. This is what separates a good radiologist from a bad one, is to find these subtle findings. Alright, so we have one patient here with normal anatomy. Let's move on to one more normal patient, but with a special finding that I first thought was a fracture. So here guys is what I wanted to show you. As you can see, we have a patient here again, and the finding here is this little thing here. It looks like a fracture, to be honest, and I thought it was a fracture, but while I've been working, I've been finding lots of these findings on the elbow, especially on the ulnar condyle. And in fact, it's actually a normal finding, believe it or not. But that's just to see a quick normal anatomy, because you're gonna see this sometimes, and don't be like afraid, don't like attack it right away. It's a fracture, boom, boom. Unless the patient, of course, has amazing pain there, then okay, it's probably a fracture, but keep also in mind that it could also be a normal finding, like in this patient. Okay, so now we have done a normal anatomy of young people. I want to show you how it looks like in older patients as well. So here, guys, we have another patient. It's also normal, except the patient is a bit older, and she has some findings that's called arthrosis. So if you remember, if you compare to the last part, you will notice that the cortex, the outlining is a bit thinner. It's like much harder to find. This is typical for older patients. And the joint space here between the bones is much thinner, it's much smaller, which indicates that there has been some degeneration, changes in her joint. So I want to just show you another normal patient, but older. And now let's get to some pathologies. Alright, so the next thing I want to show you is the elbow effusion, which is also your best friend when it comes to diagnosing elbow joints fractures. This is also called a sale sign, and you will understand why later. But basically, what is it about here? If you see the elbow joint written up like this nicely, you can look here. In normal cases, there is a fat pad here in front and behind the humerus, the distal humerus. When there's an injury to the joint, blood will collect in this area, the joint space, and what will happen is that the blood will collect and it will push out the fatty pads. And in radiology, these fat pads are dark, they're black. So from being hidden here, these are pushed out and they shape the sale sign like this. Alright, so I want to show you some images on radiology of this so you understand what I'm talking about. So in this image, we have the elbow joint again, and what you see here is elbow effusion. It's not very obvious because you're gonna see much more obvious ones in the fractures, but look at this. There's black stuff behind the humerus and some black stuff in front. And it's not always easy to see, but you have to look for this every time because this is your best friend when it comes to diagnosing pathology on elbow joints, because this is like really a good hint. Basically, I've not seen a fracture without this sign. It happens, of course, but it's very rare. So when you see like a big thing coming out here, oh boy, you have to be really looking really carefully on the bones to not miss a fracture. You can see here that there's nothing. There's no black spaces behind, and there's a thin line here, which is normal. This is a thin line, and it's completely normal. So this is a normal stuff, and this one is pathological. All right, so I want to show you one more effusion, and then we're gonna go to some more interesting stuff. So here is one more image. It's not very obvious, but you can still see that there is some difference in the contrast here. It's a darker area here, and so is here. And that's how it basically looks like in real life, because patients, when they are fractured, they don't have the energy to give you a perfect picture, so you have to accept some shittier stuff. So now we have seen elbow effusions, and now let's move on to something interesting. Alright, so here we have a elbow luxation, and if you remember how I showed you the normal anatomy, this is not the normal anatomy. This is how it looks bad, alright? So I guess it's amazingly painful because the humerus is completely out of the socket. So when I see this kind of stuff, I just feel bad for the patient. What you have to look for is, of course, for fractures, but you can also see some strange black stuff here in the back. This is probably fat effusion, But so I mean that means that there's a collection of blood in this area which is pushing out the fat. But it could also be air, because you see air is black, but I guess it's less unlikely unless he has some like big wound or something coming in and giving air. And use all your angles. So in this patient, the distal bones, which means the ulna and the radius, have been dislocated radially towards radius. And this is basically lateral dislocation, because when it comes to dislocation, you're always reporting on the distal part of the joint or the fracture. Another image just to show you the consequences and the extent of this luxation. So I want to show you one more luxation. Here, guys, is another luxation, and this is looks very horrible. And in real life, you don't get perfect images when you're dealing with this stuff, because the patient is in extreme pain. The clinician just wants to get a picture of the elbow joint as good as possible to compare later when they are fixing it. And you can see that it looks pretty bad, and there is some like stuff here that shouldn't be there. And on this image, there's a big cutoff here, which indicates a big fracture. So you have to live with this stuff here and then. And that was a quick overview of luxations. Now let's head on to fractures. Alright, so let's go to the easy stuff, the fractures. Clearly, something is wrong with this elbow. And yes, it looks amazingly bad. We all know that. And your job as a radiologist is basically to describe this fracture. It's not that difficult, guys. Of course, you can use all these eponyms and for now, but that's more for like nice vocabulary. But what you want to really tell the clinician is the way the fracture looks like, the way it is dislocated, and some other important findings that you might find. So, for example, in this patient, the humerus is completely fractured distally, and on the other angles, you can see that it's pushed forward. But when you report, you want to say that the distal part is dislocated dorsally, so pushed backwards. We only have 2 images in this patient because I guess he didn't have enough energy to give us better angles. So let's see what else we can see on elbows. Another big fracture here, really simple if you ask me. There's a fracture here through the the radial condyle. It's also connecting the ulnar condyle, and it's pretty ugly, so you're gonna try to describe as much as you can. Not as bad as the last one, but still very big fracture. So next fracture is this one. Do you see anything obvious? Well, maybe not here, but if you look on this one, then there is boom, a big fracture here. The olecranon tip has been pushed dorsally. No big deal, just describe what you see. Here's another big one, guys. There's clearly some fracture here. And it's going like this. You don't know exactly the extent of it. You try to follow the cortex really carefully. And it's going here as well. You see that beautifully. The clinicians wanted to see the extent of the whole fracture, so they did a CT, and I want to show you what they found there. So this is the same patient, and on the CT scan you can see that it's actually much more stuff than we found. Fracture there like we saw in the picture. It's much more pieces here, and it's basically a much uglier. But in conclusion, what we didn't see on the last image is that the fracture is completely across the whole humerus. And that is really important for the orthopedics because they want to know what material they want to use for the surgery later on. Anyways, though, that's it. Alright, the next image is here. And the first thing you see is like really bad narrow joint. And it's because of long-standing arthrosis. It looks really ugly if you ask me. But this patient fell, had really bad pain. And you can see that there's a fracture here, boom, in the ulna, in the olecranon space. So you made your diagnosis. You're a really good guy. And look here, here's a needle, a butterfly needle. Another image just to see how it looks like. It's a really big mess here, so when you see all this, all you want to do is cry because I can't see anything here, but it doesn't matter. You saw the fracture on one image, you can move on. So last patient of this easy stuff is a patient who came in with after a suicide attempt. He somehow fell on his elbow, and this poor guy also fractured, as you can see here, in the radial head. And if you look carefully behind, you can also see that there's a bone here missing. It's coming up here. And let's use the other angles to see what we have. So you can clearly see that there's a disruption here. There's a loosened lines here going this way, indicating a fracture. Much easier to see here. You see the cortex, guys. The cortex has been disrupted. Fracture. And this part is hard to see on other images, but since you can see it so well on this one, you will also report a fracture on this part. So now we have seen the easy stuff of the elbow fractures, and there's a lot more, of course, to show there, but my point is to just give you a quick hint of how fractures look like and the different phases of them. So let's move on to the harder stuff. This is the stuff that we get actually paid for what to do. And when it comes to subtle fractures, usually my best friend is the sale sign, because if there's a big sale sign, or if there is a sale sign at all, it's like a guy telling you, please look carefully at this image for a long time. Don't miss anything. So let's see what I have found for you guys. So this is the first patient I have for you guys. When you look at that quick overview, you can see, when I change the contrast a bit, that there is a small sale sign here, but there is nothing else really obvious, honestly. Let's move on and see what other angles we have, because that's the always thing you have to do. Do you see anything crazy here? I don't really. How about this one? Yes. Alright, so the most common fracture in adults is a fracture in the head of radius. When you follow the cortex here, guys, please, you follow it and you notice that there is a disruption here. Fracture. Good job. Let's see what other angles we have. You can't see it here. And here, you can just see it because I showed you the other ones, but really you can't see anything here. So I want to show you more. Let's get to it. Alright, the next patient is here. What is the first thing we see? The sale sign. Look, it even has a posterior one. When you see a posterior sale sign, your head has to be fractured. There has to be somewhere fractured. Just try to look. Nothing again obvious here. Let's zoom in a bit. Do you see anything? If you look really carefully, you will find something strange here. Look at that. It's so subtle, but like I said, you have to follow the cortex. And it's a bit disrupted here. It's amazingly subtle. If I zoom in maximally, do you see that, guys? It's crazy, I know, but that's actually a fracture. I'm sorry, that's reality. Let's see other angles. Nothing. It's amazingly difficult to see. Here, if we play with this a bit, you might see it better. You can also see something going on here. It's a bit strange up there. Yeah, you see that middle part. Good one, guys. Let's do more cases. So here's the next patient. What do we see? If we look carefully, there is a sale sign here, correctly. Maybe one here in the back. Do you see anything amazingly obvious? Personally, I missed this fracture, so I will never forget this. But let's see what we have. I can't really say I see anything major. Even if I stare here, I don't see anything. I don't see anything here. I'm sorry to disappoint you. And the last angle is, I don't see anything here either. I don't see anything. Wait, let's go back to the original one. Yes, there is a fracture here. Look at that. When you follow the cortex line here, you can see a small radiolucent line coming across here. It's so damn subtle. And you're a boss, you diagnose a fracture. Personally, I didn't, so I was a bit ashamed after this, but who cares? That's life. Let's move on. Here, guys, I want to show you another fun case. The first thing that pops into your eye is, of course, this crazy sale signs. You can see so much fat there, which means that blood has just moved all this fat away. I'll be a bit fast with this one because I have something else to show you, but I don't see anything here, neither do you. Nothing here, guys. Do you see anything? I don't see anything. Even this close up, I don't see anything. So I wrote in the report that it was a really big effusion in the elbow joint, so they should maybe consider to do CT in order to see what if there's a fracture or not. And we did a CT. Here's a CT for this patient, and if I scroll down, here is the radial head coming up. And now look really carefully. Did you see that? There's a fracture. It's crazy subtle, but at least you diagnose a fracture. At least you will know why the patient is in pain. So let's move on. So here's another patient, guys. This one is a really old patient, and sometimes in life these images are horrible because the patients are old, they can't cooperate, or they have too much pain. Then you have to live with this. But what can you do? You try to do the best of it. And here you don't see much obvious. I mean, the bone is really thin. But let's see other angles. Here, it's just so hard. I mean, you try to look on the cortex, everything, you try to zoom in all the way you can, but it's not really obvious. I mean, all you can do is cry when you see this stuff. So let's see what else we have. And we have this angle, and I was about to give up on this patient, but in the end I found something sticking out. And it's this little part here. This little part is subtle enough, but I call it a fracture, and the clinic was perfectly around this place, so bingo, we had it, guys. Let's see what else we have. So guys, another patient for you. Also very old patient. You see the cortex is really thin. She also fell and hurt, really painful in the elbow. When you look, you try to look, but you don't see anything. And this picture is really badly taken, so you can't really decide if there's an effusion or not. And I was really close to miss this one. I was about to write nothing or no fracture, but then my eyes caught this. Bingo. I followed the cortex here, and I saw that there is a disruption there, and that was enough to call it a fracture, guys. Plus, when you look a bit more carefully, you see that there's a bit disturbance of the skeletal context here, and it maybe goes all the way in here. And then after this one, I clapped myself on the back, and I thought I was a great radiologist. But all it takes is to be careful and to be really stubborn, to not give up. So let's see what else I have to show you. Alright guys, so I just have the last patient for you today, and this was a patient who had a previous elbow fracture but came in again with hurting his elbow. So these silly people, what is really good with radiology and the best friend of radiology is old pictures. I don't have the old ones to show you, but basically it looked exactly like this, except there was something here. And when you look at that, you're like, alright, fair enough. There's a radiolucent line, and you can see that there's some space there right next to this screw. So basically this poor patient had another fracture. I think in this case they were not so scared because it was fairly stable, this whole compartment, so they're not gonna do too much about it. So guys, we have gone over the harder stuff. And my final big message to all of you guys is to, again, follow the cortical bone very carefully. I can't stress this enough. Personally, I have found so many stuff just by following this stuff. Because when you look at something quickly, for something obvious, you're gonna miss it 50% of the time, I promise you. Then, when you see a large sale sign and you can't find the pathology like right away, just take a break for 5 seconds. That's what I do. I just look away a bit, just look around the room or whatever, and then I go back to the picture because I would just want to be really sure I didn't miss anything. Then, sorry to say, but repetition is the mother of learning. I know it's boring, but you will get better with more images. That's life. You're not gonna be perfect the first time, but I promise you, if you watch more and more of this stuff, you will get better. Don't worry. Second, it's not the end of the world if you miss a fracture. Trust me, nobody will die if you miss a small fracture of the radial head. So don't be too hard on yourself. And most importantly, try to have fun, guys. Life is too short to not have fun. So try to make your job have fun, to be funny as well. And there's lots of stuff that you can find to make your day better. Guys, I hope you liked my stuff. I hope you want to see more of this stuff. Please don't forget to subscribe, comment, and like. If you want to learn more stuff and participate in daily activities, please follow us on Simply Radiology at Instagram, and I will do my best to make your radiological life even better. Have a good one, guys. See you.